Hi everyone. Now we are going to start talking about the third more common cancer. We talk about prostate cancer and breast cancer. Those are the main cancers for male prostate, for female breast cancer. Then lung cancer is becoming very important, and then colorectal cancer. So this is becoming more common among both men and women. And it looks like in terms of death is lung cancer, breast cancer, and colon cancer for women, lung cancer, prostate cancer, and colon cancer for male. We will see more about that. So you see in this the most common cancers in the United States, as I mentioned, prostate, lung, and colorectal for men, and breast, lung, and colorectal for women. In the past, it used to be lung, but the campaign against smoking has been very successful, and then decreased the risk of this cancer. So colorectal cancer is nothing else than your bowel cancer or your intestine cancer. It's the third most common cancer in the world and also in the United States. In 2002, they have 1 million people with this cancer. It's the second cause of death by cancer in the United States. It's more frequent in men over 50 years old. 50% of the survival in 5 years. So it's good, but it's not good. It could be better, the survival. The main problem here is also diagnosed. But the main problem here is not that the diagnosis is hard to make, because the diagnosis is very simple. It's because people don't go for the diagnosis, and we will talk more about that. The most common type is adenocarcinoma. It's a disease of the developing countries. You see, in the United States, we have 40 people affected by this cancer among 100,000 people. In Africa, you have 5 people among 100,000 people, a difference of eight times. The higher incidence, ironically, in the United States is among African Americans. So that destroys the theory of genetics, or at least does not put too much fuel on that. But if you are from African descendant and you come from a country that does not have the cancer to a country that has the cancer, you become more susceptible of the cancer. Why? Mostly it's not because of something magic that happened in the air, but something that magic between column that happened in your diet, in your body, that you put inside of your body. People with higher risk of intestinal cancer, they have a former history of intestinal cancer. They have a former family history of intestinal cancer before 60 years in first-degree relatives, father and mother, or siblings. Or a chronic inflammation of the intestines, like chronic Crohn's disease, ulcerative colitis, and irritable bowel syndrome, and chronic diarrhea is related to that. Also, if a person has a history of polyps, then the risk of cancer is there. Polyps is considered considered a precursor of the cancer. And then some people have a familial adenomatous polyposis, that is a family-related or genetic disease that can predispose a person to the cancer. On the other hand, aspirin and some analgesics decrease the risk. Some people mention, some doctors advise to take baby aspirin per day, and then and check your levels of vitamin D. There is some evidence that vitamin D also might be protective, or because of lack of vitamin D, your risk is increased. This is a picture of a polyp. When the polyp starts, is already a cancer element there, and then that's why he should be removed. So whenever you have polyps in the intestines, you should remove them, or at least you should check, and that's why we advise that the main thing is to make a diagnosis. There is, instead of the tragic or the more afraid type of diagnosis, that is endoscopy, or people are afraid of the cancer because of one test called colonoscopy. Nobody wants to do a colonoscopy, especially men. They hate that. So there is now a development that you can do an assessment of your colon, your lower intestines, with the pill cam that can take a picture of the whole intestine and then give the doctor a clear evidence if you have or not the disease. But the colonoscopy is still the best test for that, and is not. In the past, people have to do sigmoidoscopy, that was with a tube, but now it's just a wire, so it's not that hard to work. It's not that painful at all, and then is the best method. And then for male, 50 years old and older, we should advise everyone to do a colonoscopy, male and female. Other methods that they have is the stools check. They have now an ability to examine the feces for cells that are altered, the DNA is altered, or cancer cells in the stools, or even blood cells in the stools that mean that something is happening inside of the intestines. Sigmoidoscopy or X-rays could be used also in places where the colonoscopy is not available. And some people also can resort to tomography, computerized tomography. But again, the best is to do colonoscopy. That is is the least side effect of all of them. What are the symptoms of intestinal cancer? It can be a change in your bowel habits, diarrhea or constipation, or the consistency of the stools, or if your bowel does not empty completely, or if you have any bleeding, or if your stools are so narrowed, or if you have discomfort in the abdomen, or if you lose weight for no other reason, or if you are extremely weak and fatigued, and if you have gastrointestinal symptoms like nausea and vomiting. Some of them are general, but we are looking for something that starts all of a sudden and stay for weeks without being affected by any treatment. I remember one friend of mine, he went to a trip to Thailand and got diarrhea. When he came back, he was even hospitalized because he got so dehydrated for that. And then he improved, but the diarrhea continued. And then he went to check, and he had colon cancer, unfortunately. What are the main causes of cancer, of colon cancer, colorectal cancer? Red meat is in the first place, and is convincing. By the World Cancer Research Fund, the experts figured out that both red meat and processed meats are related to the cancer. Also, alcohol drinking, mostly for men. For women, probably, but not with hard evidence. And then obesity and having more abdominal fat, and then the adult attained height. So we have this graphic that showed that the countries that consume more meat, in the bottom we have the amount of meat that they consume per day in terms of grams, and then in the vertical column the incidence of colon cancer. So there is this correlation. This is called ecological correlation. It might not mean anything, but if you have later on studies that will do to check what are the factors inside of each of these countries that correlate with the disease, then you confirm this. Also, there is a correlation between the animal source of calories in many countries with the cancer, the colon cancer. The highest the amount of animal product that people use, the highest the incidence of colon cancer. So we have to be sure that red meat should not be one of food that is frequent in our tables. And I am from south of Brazil, belong to my family that has the tradition of the gaucho cowboys in south of Brazil and Argentina and Uruguay. They live with red meat. Red meat is part of the tradition. If you don't eat red meat, you are not a gaucho. But I have to tell you that unfortunately for them and unfortunately for some of my relatives, red meat is not a good idea. There is a lot of carcinogenics that can be formed there. When they heat the meat with a higher temperature, you produce heterocyclic amines that are cancer agents. And then if you have the meat being heated and that the fat that is melted from the meat, if that fat is burned, it can produce PAH, polycyclic aromatic carbons. One of them is the benzopyrene. And the benzopyrene is the same substance that we find in cigarette smoking that causes lung cancer. Now you are eating meat is like you are smoking to your stomach, is smoking to your intestines and increasing the risk of cancer in that area. When we talk about red meat, we are talking about beef, pork, lamb, goat, or domesticated animals. The processed meats refers to meats preserved by smoking, curing, salting, or the ones that are addicted to chemical preservatives. This is not a banana you see in the picture, but is a sausage that someone put inside as a trick. So banana for sure is anti-cancer, but sausages are not. Meats such as salami, bacon, cured ham, and hot dogs increase the risk of bowel cancer or colorectal cancer by 30 to 50%. Processed meats increase the risk of polyps because of the nitrates and nitrates that they produce. And those are substances that are put there to preserve the color of the meat. If you put this meat in a freezer, or if you don't put the preservatives, the meat will get dark, and nobody will eat that. Maybe they should have it dark, and then people will not eat. But then they put the nitrates and the nitrites, and then it gets back the redness. But with the redness, it comes back the cancer substances. The American Institute of Cancer Research has a big concern because the evidence show that processed meats, that is an everyday use thing and celebration things during 4th of July, Memorial Day, Christmas, name the holiday, and they are eating hot dogs. But these might pose a clear and serious risks. So if you are American, but if you are German, if you are Brazilian, which race you are, no matter what race you have, you should use less processed meats. And for sure, I don't eat meat, but I don't advise to eat red meat also, and processed meats, and don't eat that daily, please. This is a joke. Oh, looky, Fred loves these things. Didn't Fred die last January? Probably with colon cancer, her friend asked. Excessive drinking is related to colorectal cancer in men. And then the threshold is 30 grams of alcohol per day. 30 grams of alcohol would be like 3 doses of liquor or 3 drinks in general. What happened in men is the same thing that happened to alcohol for the prevention or for the effect of heart disease. If a person has a low dose of alcohol, he has the risk of colon cancer is higher. If he drinks, the risk is low, and then if they drink more, the risk is there. The evidence that all types of alcoholic drinks increase the risk of a number of cancers is now stronger than it was in the mid-90s. There is convincing evidence that alcohol increases the risk of cancers of the mouth, pharynx, larynx, esophagus, and breast, as well as colorectal cancer in men, that is convincing, and probably colorectal cancer in women. Alcoholic drinks also probably increase the risk of colorectal cancer in women, as we mentioned, and also liver cancer also is related to alcohol cancer. There is convincing evidence that alcohol increases the risk of cancer of the mouth, pharynx, larynx, esophagus, and breast, as well as colorectal cancer in men. And alcoholic drinks also probably increase the risk of colorectal cancer in women and liver cancer both for men and women, as alcohol increases the risk of cirrhosis and hepatitis C, or hepatitis, alcoholic hepatitis, that are a precursor of liver cancer. Say no to alcohol is the best advice that I could give to you. Then the other is abdominal fat. There is an increased inflammation when a person has an abdominal deposit of fat, and this will increase 5% the colon cancer risk for 1 inch of excess of waist circumference. 1 inch more on your belt will increase the risk 5% of colorectal cancer. And then you have 30% increase in your risk of colorectal cancer per 0.1 increment in your waist and hip ratio. How do you measure the waist and hip ratio? Usually you measure your waist according in the middle of your umbilical, and then in your buttocks, in the highest circumference of your buttocks, and then you divide those numbers and you have this level there. We know that then the waist circumference should be less than 38 inches for male and less than 35 for female. Are you going to measure my waist? I don't think so. But in any ways, we should know our waist, and we should know that we have a higher risk of that cancer, of this cancer, if we have our abdomen overdeveloped. Then another point is the adult attained height. This is Yao Ming, a famous Chinese player in the NBA. But it looks like we cannot do much about that. I mean, there is genetic, environmental, hormonal, nutritional factors that can affect growth during the preconception to complete adult growth. My advice should be careful of what you eat during pregnancy. Be careful what you eat during breast milk breastfeeding, and be careful what you give to your kid when he is growing, because an accelerated growth and a biggest baby will have a higher risk of the disease, mostly when they got old. So it's not good to mature too fast. It's not good to raise to become big because of, I would say, environment, hormonal, and nutritional. You cannot do anything about genetic, but you can do something about the others. There is some convincing protection, and the two main factors are physical activity and foods containing dietary fiber. We know also that occupational, household, and transport and recreational physical activity all equally can help a person to decrease the risk. It does not need to be just recreational or going to a gym, if you can call this recreational. I go to a gym, but I don't like much to go to a gym, but I go daily there. But it can be other things. Can be stay busy and do something in your daily life in terms of exercise. And then we go to fiber. Dr. Dennis Burkitt, he was the father of the fiber and the benefits of the fiber. He would say that the health of the nation is related to the fiber in the diet. Essentially, he would estimate the size of the stools, and he would say the health of a nation is proportionate to the size of their individual or citizens' stools. It's a joke, but it's kind of truth. Fiber and colon cancer, it became a tradition. The current research does not follow much, but still, even though there are conflicting studies, is a confirming evidence that fiber really reduce colon cancer. Why do we need fiber? So if we go and talk more about fiber and not about cancer, you see that they help in your digestive system, and prevent constipation. They lower blood cholesterol and triglyceride. They lower risk of colon cancer, heart disease, and digestive problems like diverticulosis. Improve blood sugar in people with diabetes. Improve the weight management because people will eat less. And how many fiber you need? They mentioned that we need about 25 grams of fiber for women and 38 grams of fiber per day per male. I advise everybody in my office to eat at least 40 grams of fiber per day. Dr. Burke would add other problems that the fiber can fix, like diverticulitis, appendicitis, hernia, gastroesophageal reflux disease, like people that have heartburn are the ones that might need more fiber. And then Burke also mentioned about hemorrhoids and varicose veins that might be related to the intake or the small intake of fiber. And then I like to use this chart, the Bristol stool chart, that gives you the idea of what is the ideal size or the ideal consistency of the stool for you to have an idea. And type 1 and 2, type 1 is separate hard lumps, and then type 2 is a sausage shaped but lumpy. And this is mostly because people don't eat enough fiber. They don't eat much fruits and vegetables, beans, and whole grains. Then type 3 and 4 is like a sausage, but it has cracks on the surface, not lumps. Or is like a sausage or a snake, is smooth and soft. These 3 and 4 are the normal types of stool. Then you have type 5, that is soft blobs with clear-cut edges. So this is not very good. And then fluffy pieces, and then watery. Mostly type 5, 6, and 7 are related to, it can be related to lack of fiber, but it can also be related to your intestinal flora and what they call the microbiota that is not is affected. I remember that my stools became very watery after one time I had to take an antibiotic and then for many months I had to take other probiotics in order to compensate and change the consistency of my stools. But ideally we should have like a sausage with cracks, or like a sausage or a snake, type 3 and 4. And the main issue here is to eat more fiber. What is the mechanism for fiber in cancer? Decrease intestinal transit time. So if you move the food very faster in the intestines, you don't have the exposure of the chemicals with the mucosa to produce the disease. And there is also bacterial fermentation that produce the SCFA, short-chain fatty acids, mostly butyrate. Butyrate is proven to induce apoptosis and other process of cancer cell development. And then when butyrate is there, there is less risk of cancer. Other cause could be that maybe there is folate or carotenoids or isothiocyanates that might be important in the effect of fiber and cancer. Here you have a list of the richest source of fiber. I will tell you that this is one of my favorite slides. And the reason for that is on the right column on that, when you find that Lentils, beans, and legumes are the richest source of fiber. Navy beans being the champion with 15 grams of fiber per serving. So there is no other food that is that rich in fiber as beans. So you have to put more beans in your diet. The other point in this that I like is that in the right column below the beans you have eggs, meat, milk, and cheese. How much fiber do they have? Zero. So please use more whole grains, more beans, more fruits and vegetables, more berries. Berries are very rich in fiber too. In China, there is a very interesting study. Somehow I lost the reference of this study. But you see the consumption of fiber among Chinese. It goes to the prescription that we do, close to 35 grams per day. On the other hand, Americans use 10, maybe 12 grams of fiber. That is less than half of the amount of fiber that the Chinese consume. And then if we compare the risk of colon cancer among the Chinese compared to the United States, is less than half for either male and female. So this might call for other effects or other factors, but the fiber is still very clear. In the Adventist Health Study 1, we found that the consumption of beans twice a week decreased the risk of colon cancer for 42% less. And that the ones compared to the ones that consume once a week only. And this is twice a week. Imagine that if they use 5 times a week or 6 times a week. Higher risk of the cancer with the consumption of meat, bird or chicken, and fish several times per week. And consumption of fruits and vegetables decreased the risk of cancer by 40%. Polyps are precursors of colorectal cancer. So in the Adventist Health Study 1, they figured out that the consumption of brown rice 3 times a week decreased 40% the production of polyps. And consumption of the consumption of legumes 3 times per week decreased by a third, 30% less risk of polyps that are precursors of colon cancer. The consumption of dry fruits decreased 26%, the consumption of green vegetables 24% of the polyps. So all of these are vegetarian foods that are very good to prevention. There is another group of foods or substances that decrease the incidence of colorectal cancer, but is a probably effect, is not convincing as the other ones. So garlic and its family, milk and calcium are protective against the cancer, and cheese, on the other hand, might increase the risk. Fruits and vegetables are suggestive to decrease, and sugar is suggestive, sugary foods suggestive to increase the risk. Here we have another research showing that increasing intake of olive oil might decrease the risk. So they compare countries that use a lot of olive oil. All of these are Mediterranean groups. But among the Mediterraneans, the highest consumption of olive oil is in Greece, and they have the lowest incidence of colon cancer. It's ecological, but it gives us an idea. If you are not familiar with Greece, they say that in Greece they use olive oil in a different way that we use in the States. We used to put some drops of olive oil in our food, in our salad here. In Greece, they drink olive oil with a cup. That's what they said. This study done in 1996 showed that drinking at least 5 cups of water per day may be another preventive factor against colon cancer. They figured out that in higher intake of water in women and men decreased the risk, but it was not significant for men. The effect was mostly for women that drink 5 glasses compared to women that drink 1 glass per day. They have 45% lower risk of colon cancer compared to the others that did just 1 glass per day. And then rats increase the intestinal cancer when they have restricted fluid intake. Curcumin is also the yellow part of the curry that also is has an effect probably against colorectal cancer because they block the enzyme cyclooxygenase, or COX2, that is the phase 1 enzyme. Remember, phase 1 enzymes are the ones that accelerate and produce more carcinogenics. On the other hand, CYP450 are the phase 2 enzymes. And phase 2 enzymes CYP450 are also phase 1 enzymes, and fruits inhibit the expression of these enzymes, decreasing the risk of cancer. CYP can enhance toxins and produce more carcinogenesis, and then eating more fruits will improve that. Now I have a video for you guys, so let's see what is a summary of the cancer prevention and cancer ideas.
Everyone, of course, wants to reduce their risk for bad cancers, and colorectal cancer is no exception. So the question is there something you can actually do that might reduce your chances of getting colon cancer? And the answer is yeah, maybe. So first, and maybe the most exciting of all, is that there's pretty strong evidence that exercise decreases the chances of getting colorectal cancer. Now, it doesn't mean you have to go out there and start running marathons. Actually, I jokingly will prescribe a dog for my patients just to get them to go out and move on a daily basis. Park the car a little further away from the mall entrance. Take the stairs at work. Little things like that can indeed help. The second, and maybe one of the harder ones, is diet. Now, you don't have to go crazy here. We do want sort of a balance of high fiber, low fat diet. Many people say the Mediterranean diet is the ideal thing. That doesn't mean you can't go to Ben & Jerry's or an occasional Outback Steakhouse visit, but you do want to balance that with more fruits and vegetables, sort of better fresh foods for your bowel, if you will. Now, there are a couple of things that point to medicines. There's a lot of talk out there about vitamin D and possibly the role for calcium. So I instruct most of my patients to take a little extra vitamin D. Calcium may be out there as well. And then for the over 50 crowd, or certainly those with a history of stroke or heart attack, baby aspirin. Fascinating data that if one were to take a daily baby aspirin, 81 milligrams, there's good evidence that that decreases the chance of developing colorectal cancer. Finally, of course, is screening. That's probably the most important piece of all. Colon cancer almost always starts as a polyp. If one goes and finds that polyp and remove it before it has a chance to become cancer, you'll prevent ever getting the disease. So stay out of my office through diet, exercise, a little bit of vitamin D, colonoscopy, baby aspirin. Stay out of my office.
Now, just to complement what we have said about colorectal cancer, I got this from this book, Lifestyle Medicine, from Dr. Rippey, Dr. Rip is one of the editors of the journal Lifestyle Medicine in the United States, very famous journal and very new in terms of prevention of disease. So in his book, he mentioned that red meat increased the risk when a person eats 180 grams per day compared with a person that eats 20 grams per day, and the risk increased by 35%. So I would advise, if you cannot stop eating meat, at least don't eat every day, or don't eat that much. So fish was not significant. Fiber probably was protective, and then calcium intake is protective, but remember, calcium intake might be related to milk intake, and this might increase the risk of prostate cancer. Other substances that might increase risk, antioxidant supplements, they didn't have any effect, or at least confirmed effect. Exercise produced 50% of reduction, we already saw. Even with people in stage 3, remember, cancer has 4 stages, 1, 2, 3, and 4. 1 and 2 are very in the beginning. 1 is local, 2 is little local, 3 is a little forming a tumor, but is still local, and 4 is when you have metastasis. So even a person with stage number 3 colon rectal cancer could improve if they start a program of exercise. Lack of sleep may be another factor for those that sleep less than 7 hours per night. This is a new factor. We don't have a confirmation from the World Cancer Research Fund. The experts are not unanimous on that, but there are some studies mentioning that sleep is important. And we can believe on that because when you sleep, your immune system is developed, is increased, is activated. So if you don't sleep enough, less than 7 hours, your immune system will be suppressed. And then immune system also combat cancer. Overweight increase the risk for men and is related to abdominal fat. High levels of insulin or insulin-related growth factors might enhance the adenomatous growth in the colon and then lead to evolution of a cancerous tumor. So most of people that have abdominal fat have insulin resistance. And insulin resistance means that a person has a lot of insulin. And as we mentioned before, insulin is a cancer promoter. Estrogen therapy seems to protect against the colon cancer development, but obese women taking estrogen increase the risk of the cancer. And then that's not a good idea. The treatment for the disease is surgery, radiation, and chemotherapy. Surgery is the primary if the cancer is located, very well located. I have a story to tell you to finish this section. Mrs. Duarte came to my office because she had a polyp. She had an intestinal polyp, and then when she went to the doctor, and then on that time they told her that the polyp was benign. Again, there is no such a thing as benign polyp. Polyp is starting in the intestine, is already a precursor for colon cancer. And then the doctor said, don't do anything, and then just come back later in 2 or 3 years for that. So 2 years after that she came, and then when the doctor checked, there was a polyp in the on that, and the polyp now is stage 1 cancer. So as a colon cancer stage 1, if they have taken this excised it in 2 years before, he never will develop, but now she developed it. Fortunately, it was type 1, and then she was unhappy. Why didn't you take this before? She was desperate. And what am I going to do? I mean, am I going to have surgery and radiotherapy and chemotherapy? What is that is happening? Fortunately, this type of cancer, they removed during the biopsy, and she didn't have to have anything because it was very tiny. But she was not happy, and then she came to my office explaining the whole situation. And then I told her my advice. Hey, put more fiber in your diet, more fruits and vegetables, legumes, pulse, beans. No meat, no fat, or low fat. Avoid refined grains, avoid junk food, and start a program for exercise right away. She did. After 5 years, she had normal colonoscopy, no polyps anymore, and she was happy. But we know that it takes more than 5 years to develop a new polyp or cancer cells to develop. However, she will continue both following a good lifestyle, as she is doing, and then checking periodically, as is important. This is the Bible verse for the end of this, because even though we have cancer, one day this cancer is not going to be with us. And we talk about fruits and vegetables, and it looks like in heaven we will have this tree that bear 12 crops of fruit, yielding its fruit every month. And the leaves of the tree are for the healing of the nations. So if you don't like vegetables, you better do something else, because in heaven you will eat vegetables. And probably these will be the ones that will prevent you to have cancer in heaven. Thank you very much for your attention, and I will see you next with cancer of the pancreas, one of the most complicated cancers that we know. Thank you very much. See you later.